I've got a really loud voice, so if I kind of start booming out, just tell me to quieten down, because I get really excited about this area of research. I think that before I begin, I'll give 2 top tips to presenters. Firstly, always present your presentation early in the day, so other people haven't said what you want to say. Not pointing anywhere in particular. And secondly, never follow a parent. So I've got a challenge straight away, because I'm a dry, boring academic that's interested in statistics. You know, they really bake my noodle. My research team kind of like wonder why I'm so excited about data. But joking aside, we really need evidence to drive this forward at a policy level. We need to find out which programs are working, how they're working, where the benefit is seen, is the differences between models, etc., etc. So today my talk is actually going to focus on a delivery of a number of holiday breakfast clubs across the summer holiday. Research was sponsored by Kellogg's, and they were very kind and they gave me a free rein to do what I want, which I was going to do anyway, as they know. And without them, we wouldn't have been able to conduct the research. It's quite a big project, even though it's a pilot. So without further ado, I will begin. Now, I'm here today presenting this talk, but really, most of the credit goes to my team. I lead a research centre now of over 30 academic staff, consisting of nutritionists, people of experts in social policy and social workers, health economists, statisticians, social geographers, designers, physiologists, PE activity specialists. I can go on and on. If you look at our website, you see a whole list of the 3 people that contributed to this project. Most of all, probably Dr. Pamela Graham, who's sitting right here trying to keep her head down, is my postdoc, and she actually went out and collected the data. So if you don't like what I'm saying, see her. Are we getting anywhere? No. It was working. Can I take that one out? No, can I go back to yours? We'll try this one. Ah. Okay. Whenever I'm giving an academic talk about holiday hunger, I normally present this slide, because when you're talking about hunger to the lay population, this is what people think. This is the image that comes to mind. And whilst 98% of those affected by food poverty reside in developing countries such as Africa, there's a large proportion of children now in the UK that suffer from food poverty. From food poverty, I'm actually taking the Department of Health's definition in 2005 as the inability to buy or access food to provide a healthy diet. And so we switch from this picture to that picture that's been taken in the UK. And even as a researcher with my objective hat on, I find this chilling. This is us, and this is what we are at the moment. Research has shown that in 2012, there was over 500,000 children that met the criteria for being in food poverty. From those households, 93% of adults skipped or sacrificed a meal to feed their children. So the myth that actually these families, they spend it all on vodka and cigarettes and big screen TVs, they want to feed their children. So that's the first myth I want to dispel. Our research clearly shows that is not necessarily the case. When you look at the main food providers, the Brussels Trust, FareShare, Food Cycle, food banks have increased significantly by about 54% between 2012 and 2014, and are continuing to grow. As was said earlier, this increase has been related to changes in benefit systems. It's also been related to inflation in terms of food, which over the last 2 years has risen by 12%. Relative pay has dropped by 7%. We now have a massive population of the so-called working poor. Needs to be considered. And accompanying this, which is rather chilling, is the fact that people's food buying habits in these circumstances is changing. So I'm looking on one side of all of the changes brought about in Change for Life, universal free school meals coming in, and yet we know from research on this side that people that are in deprived situations, that are suffering from food poverty, tend to buy sugar that's laden in fat, salt, sugar. And the reason that they're doing that is that it's perceived as not only being cheaper, but also as more satisfying to fill up empty bellies. Okay. So you can see right here that when we're looking at public health initiatives, Department for Education, Department of Health drivers, we have on one hand a load of excellent work going on, but then we have this kind of like gap of this 170 days in the school holidays that we really need to look at. So whilst generally we're looking at food poverty, we know from what we've heard this morning that during the summer holidays in particular it becomes a crisis of need. So why help? Why should we do something? Well, apart from the moral, social, financial obligations, I can give you all the data on that. There's also this, as Lindsay referred to earlier, is that sufficient access to food is recognised as a basic human right. Access to food. Let's switch back to what I started off saying at the beginning. In 2005, Department of Health, food poverty is inability to access food to maintain a healthy diet. And this is where we are at the moment. So I love this quote here by Fisher. It says, first we eat, then we do everything else. This is me. I eat first, because I can't do anything before I eat. You can see. But it's really important as well. So over the last probably 15 years, my lab's been doing lots of research into the effects of food on children's cognition and educational attainment. And we know there's a clear link between diet and educational attainment in deprived communities. The link is not so clear in middle-income households, by the way, but definitely in deprived communities there's a clear link. The link is also not as clear in adolescents as it is in primary school children. And I can talk to you for hours about that if you wish, but I won't today. So we know there's a link. And we know that governments are actually recognising this. So if you look at work by the World Food Bank, if you look at work in this country of universal free school meals for 5 to 6-year-olds, if you look at the government's sponsorship of breakfast clubs, corporate sponsorship of breakfast clubs, we are doing something about it during term time. But we need to look again at what we're doing during the holiday period. So, everyone today has talked about lunch, so I'm going to switch this and start talking about breakfast. And I'm going to give you some reasons why breakfast is also important. So, is it enough? Here's the question. Is it enough just to provide one meal a day to a growing child? There's your answer. We know in terms of physical development, emotional, social development, maturity of the brain, that the brain continues to develop until about the age 21. So not longer than people first think. People think that when children become adolescents, okay, they've got a few issues that not being able to stay in and be good and all the rest of it. I have a 22-year-old son, which is why I look like this. We know that, right? But actually, when I look at my 22-year-old son, he's now doing a master's at Northumbria University. He's only a year mature in his brain capacity. How many people look at their 20-year-olds and think, their brain is still developing? You don't. We treat them as young adults in our society, and with that comes risks. So this is actually a picture where, so I've put this up because this is actually Pam's daughter. She had a baby as well as doing a PhD. Obviously I wasn't working her hard enough. She had time to spare. We know that's important for some reason, but we also know in terms of research it's really important. Breakfast helps in terms of cognitive performance. Breakfast helps in reducing unhealthy snacking across the school morning. Breakfast breakfast helps in social relationships because it's a meeting of people together to share the first meal of the day. It's actually breakfast, it's breaking the fast. We also know that it helps in later life, in healthy weight management, preventing type 2 diabetes, and I can go on and on. So I'm not saying breakfast is necessarily more important, I'm saying all of the meals are important. We cannot substitute just one meal for a school term when children are having breakfast and school lunch. There's no way that you'll be able to make up the nutritional value in either macro or micronutrients across that period with just the one meal. So I hope I've convinced you of that. So, quite a lot of people talk today about not just giving the food, but also the other aspects, the social aspects, and I know some workshops this afternoon will be looking at this. I'm not going to bore you with all of the evidence that parents find the 6 or 7 weeks hard. I think everybody's got the message that wasn't converted before they came here today is now converted. But I am going to talk about some of the research evidence. So, research in the Food Research and Action Centre in 2012 conducted some research where they looked at, let me just check on what it says, right? Yeah, they looked at children's meal intake over the summer period. And they compared it to meal take during term time. And they found differences. Meal intake during the holiday break tended to be more sporadic. It had less nutritional value. Combined with this, evidence now coming from the Youth Sport Trust shows that children, counterintuitively to what a lot of people think, are actually less physically active over the summer than they are at school. Part of this is attributed to a lot of the programs of physical activity, PE programs now going into school. So let's just put the two together. You've now got a summer period where children are eating high fat, high salt, less nutritious food, with less physical activity, and you can see the growing obesity crisis staring right down the barrel of the gun to me. Other research has examined the early childhood longitudinal study looking at the kindergarten cohort. And this is research done by Von Hippel in 2007. And this was quite an interesting study because what they did is they took measures from the data of BMI during term time and during the summer period. And BMI is just an abbreviation for body mass index, as most of you probably know, and it's almost like a proxy for healthy weight. There's quite a lot of academic debate of whether that should be used, but let's just take it as said. The results showed that actually there was a more significant and quicker gain in BMI across the 6-week summer period than there was across the whole term time period. So there's some real hard evidence on the short-term impact of the summer program, or the lack of the summer program in terms of feeding. All right, I'll hurry up. I love to talk. So, I've been told to hurry, so I'm going to canter through, but I'll leave some of the quotes up for you. So, we conducted this study to look at the impact of summer breakfast clubs, and we looked at health, social, and economic outcomes. So, we're trying to get some hard evidence here. We used the mixed methods approach, involving self-report questionnaires given to parents and semi-structured interviews, in which we looked at key stakeholders, so we looked at staff, children, and parents. I won't bore you too much with that, we'll go on. We looked at 5 clubs overall, 6 clubs overall. The importance of looking at different clubs is that the clubs were working slightly different models. So although I'm not going to present the data here today, because we'll have a paper coming out very shortly, it enables you to look at which type of program is the most effective, which has the most impact against the various measures that we're looking at. The measures were breakfast provision, so what was provided, was it different from home? Recreation, so that includes physical activity and hobbies. Family impact, the impact on the family. School preparedness. Now, school preparedness is an interesting topic. Often we look at it going into primary or the switch from primary to secondary. There are some academics like myself that would argue school preparedness is after the long summer break as well, so when you go back to a new form, a new class teacher, you have to be prepared for school. And some of the anecdotal data coming from teachers suggests that the first few weeks in September is quite a riotous period for some schools, especially those in deprived areas. and we finally looked at food security. So here's some of the data I'm going to be talking about. The first part of the questionnaire just simply asked some questions. So it was like, it's harder to make ends meet during the summer than during the school year. 71% of the parents agreed with that. We spend more money on food during the summer than during the school year. 94% of parents agreed with that. We sometimes find ourselves without enough money for food during the summer. 62% of parents agreed with that. And this data here is presented slightly differently for a reason. And I'll see it, I don't think my pointer will work. No, never mind, but we got way back. It's a bit small, so apologies for this, but I want to draw your attention to a few important aspects. First of all, the main thing that you find is parents cut down on spending on other things. So in order to feed their family, they cut down on social, cultural activities. And this has been already brought up this morning about the need for activities within the clubs. Only one parent, this sole little outlier here, made no changes. One parent out of all the parents that we surveyed. Everybody else made significant changes. But importantly, they didn't go directly to food banks. So this is the use of food banks right here. So you can see that parents tried a number of strategies to cope, and some parents actually chose multiple strategies at coping across the summer. You two probably there. So we then looked at breakfast provision, and I'll just draw your attention here. This was on a Likert scale of 1 to 5, with 1 strongly disagree and 5 strongly agree. We're presenting the data in 2 different ways. You can read it in the paper. But if you notice here, when you look at the means, anything of a mean of above 3 is that they strongly agree. Now, for me, as a researcher, these data are remarkable. They're close to what we call ceiling. There's not much further for them to go in terms of their agreement. Likewise for this, looking at school preparedness, that hasn't been talked about too much today, and the physical aspects of it as well, should it be available for more hours. Semi-structured interviews addressed 3 questions. So we looked at what are holiday clubs used for, what are the perceived impacts of holiday breakfast, and what factors need to be considered in development. I'm just going to give you briefly a few quotes. I won't dwell on this because we've already heard from a parent that is far more motivating than my quotes. We used also on top of this the USDA Household Food Security Survey to measure the level of food insecurity in our participant group. Now, the important thing here is I'm not cherry-picking quotes here. So we actually used age-appropriate interview schedules to guide discussions with parents. We reached until we reached what we call data saturation. They were orthographically transcribed. Each transcript was read looking at main themes and sub-themes. And we also looked at what we call inter-rater reliability using a statistic called Cohen's kappa to make sure that we have objective agreement between raters, that actually we're not just picking out what we want to pick out. I'm not going to talk a lot about this. I'll hand them out later. But there's lots of views that echoes exactly what's been said today. In staff views, social impacts, it's not just about food. Impact on the family, the wider family, not necessarily just the children attending the holiday club. Children echoed the views of parents and staff, looking at breakfast habits. I love this one here. At home, we just rush around a bit and we don't really eat. We also looked at the social time, making friends, getting other children off computers. He's just been on his Xbox all the time, so looking at the physical activity. Finally, we looked at the adults' view, and again, these views, we've got strong concurrent agreement across all our themes here. Last slide. Julia. So I'm going to turn back again to food security. And food security, rather than food poverty, has been defined as access at all times to sufficient, safe, and nutritious food for an active and healthy lifestyle at affordable prices. And this was a quote by Defeyter in 2008. Out of our sample, 57 participants were considered on this survey to be food secure, but 43% were not. So we've got a lot of adults here on the survey that are reporting in food insecurity. It's more than just feeding. we need to look at the impact on social and educational achievements as well. Evaluating a complex intervention is complex. Okay? We need multiple academics working together to pool resources, to pool areas of expertise, because there's lots of different things happening here. And probably finally, one of the things we learned from our intervention, evaluation of the intervention, is we have to balance the intervention with the evaluation. It can't just be such rigorous evaluation that everybody gets turned off going because it's boring and it's like school. But it also can't be light touch. It can't be that we're getting findings that aren't valid and reliable, that we can't generalise to other clubs, because if we do that, we won't have actual evidence to drive forward policymakers. And finally, I'd like to thank all the children, parents, guardians and staff from the clubs. Thanks to Pamela Graham and Louise Harvey-Golding, who was our second coder, and thanks to Kate Prince from Kellogg's for funding our research.